Hello, and welcome back to the channel. It's your public health safe space. Today, we're taking another journey. We're discussing another topic, but today we're going to talk about some conditions that occur because healthcare seems to be lacking in certain situations. So, as always, like, comment, share, subscribe. We're on this journey together. It's your public health safe space where meaningful conversations occur. Today's no different. So let's get on the journey. It's a beautiful day. I hope you're enjoying your day. Let's go. As we said, welcome back. As we said, we're going to continue the conversation. And I want to be serious about this because it was brought to my attention based on consistent observation. Seeing people who you see them, they're amputated, they're blind in one eye or both, you know, and you have certain concerns, especially as you travel the world, whether it's first world or third world countries, you could see the difference. So I decided, let me do some research and put this together. And here is what I am about to put together for you from a public health perspective. Now, every day someone loses their sight, someone loses a limb, a mother doesn't survive childbirth, and in many parts of the world, a child is born into a system that cannot deliver them safely, dying whether minutes, hours, or days after birth. And this one hits hard because there are so many cases that you could see. Many women are able to tell stories of other women that they've met in similar situations. Not because medicine doesn't exist, but because the system failed to deliver it in time. Same world, same diseases, but very different outcomes. Across the world, people face the same conditions: diabetes, infections, pregnancy complications, and of course that big one we all cannot get away from, cancer. But outcomes depend on something deeper than medicine. In stronger systems, diseases are detected early. Treatment starts quickly, complications are prevented. Every video there's a dog barking. Do you hear that? In weaker systems, diagnosis is delayed, treatment is limited or unavailable, and preventable conditions become permanent disabilities, or, dare I say it, even death. This is not just about disease. This is about whether a system works or fails. Millions live with vision loss globally, and much of it is and was preventable. Conditions like cataracts, diabetic eye disease, untreated infections, or tears. In well-functioning systems, routine screenings catch issues early, treatment restores or preserves vision. In weaker systems, symptoms go unrecognized, care is delayed, access is limited. Blindness is not sudden. Oftentimes it's not sudden. It's a slow loss that no system interrupted. Now let's take a turn. Let's look at amputations. That starts with a wound, an infection, a chronic condition left unmanaged. In some system, it's treated. In another system, it becomes an amputation. Causes include untreated diabetes, infected wounds, trauma without timely care. In some places, a small injury heals. In others, it becomes permanent. Many amputations are not inevitable. They are the result of missed opportunities for early care intervention. This is where the system failure is most visible. Mothers die from hemorrhage, infection, complications that are treatable. Newborns die from birth complications, infections, lack of immediate care, often with minutes, hours, or even days after. A child should be born into care, not into risk. In stronger systems, skilled professionals are present, emergencies are managed. In weaker systems, Help comes too late or simply not at all, and the result is loss that could have been prevented. Now, let's look at cancer. Cancer affects every single country, but survival depends heavily on early detection, access to treatment, system capacity. In high resource systems, cancers are caught early, treatment is available, survival improves. Not guaranteed, but improves. In weaker systems, diagnosis comes late, treatment is limited, outcomes worsen, and we know the inevitable. Cancer is not always fatal, but in some systems it becomes one, a fatal one. This is not just about access, it's about awareness. Many people don't recognize symptoms, delay care due to cost, rely on alternative methods, or fear the healthcare system altogether. They are not ignoring their health. They were never equipped to recognize the warning signs. And this is where public health should lead. But too often, public health education is not reaching the people who need it most. Now, who is affected? Which is most widespread? Blindness affects the largest number globally. Cancer leads in overall mortality burden. Amputations are fewer but severely disabling. Maternal and newborn deaths are highly concentrated and highly preventable. Now let's take a look at what we would refer to as the men versus the women. For men, more likely to experience amputation and blindness, higher mortality in some cancers, and often delay seeking care. And this is something that has spanned generations. For some reason, men delay going to the doctor. They have their excuses are, I'm afraid of the needle, oh, I can't be bothered, I don't have the time, I have to go to work. We have to intervene and make time. Now, when we look at the women, on the other hand, they face maternal health risk, experience systemic barriers to care, and carry a disproportionate burden in low-resource settings. The difference is not just biological, it's structural. Now let's make this real. Let's compare countries with stronger healthcare systems to those still struggling with access, resources, and public health infrastructure. Now, in high-income systems, we would say, let's say United States, United Kingdom, and Canada. In these high-income systems, they are not perfect, but they share critical strengths: established primary healthcare networks, routine screening programs, higher numbers of trained professionals, strong emergency response systems, and ongoing public health education. The results from these high systems are lower maternal deaths, higher cancer survival, fewer preventable amputations, treatable blindness addressed earlier, and these systems are built to intervene earlier as well. Now, in lower resource systems, we could look at systems like Nigeria, Jamaica, Haiti, Sierra Leone. These systems face some of the highest burdens of maternal and newborn deaths, preventable blindness, untreated infections that lead to amputations. Challenges include shortages of healthcare workers, limited access to skilled birth care, weak primary care systems, limited screening programs, financial and geographical barriers, and unaware patients based on lacking public health infrastructure. The result here is higher mortality and disability rates, late-stage disease presentation, preventable conditions becoming permanent. These systems often meet patients way too late. Now, with our final comparison, it's not that the disease are different. It's that the timing of care is. In stronger systems, healthcare prevents suffering. In weaker systems, it responds to suffering after the damage is done. So you ask yourself, okay, I've said all of this. What needs to change? Well, at the system level, we could strengthen primary health care, train more nurses, doctors, and midwives, and not just train them, pay them wages that help them survive so that we don't also see brain drain. Because I know even Jamaica, they're suffering from brain drain within their health system. We could also expand screening and early detection, improve access to essential treatments. From a public health perspective, invest in education, that's public health education, increase awareness campaigns, and reach underserved communities. Some people say, well, we do go to underserved communities. The question is, how often do you go? Now, from an individual awareness basis, we recognize symptoms earlier. So the public education will help people to recognize these symptoms earlier, seek care sooner, and address small issues before they escalate. Now, with all this given, I am going to present to you 10 powerful consultation awareness questions. These are questions that you want to be able to understand and to ask your provider. Know that the provider is not going to turn you away because you have questions. The provider wants you to share your health history and ask questions. So here are some questions, and we're going to categorize them. I say 2 per problem or issue that I discussed. So for blindness, here are the 2 questions. What early signs of vision loss should I watch for? And the second, how often should I have my eyes examined? Very important to ask your provider. For amputations, the 2 are, what are the warning signs of poor circulation or nerve damage? Secondly, what should I do if a wound is not healing properly? For maternal and newborn health, which is important, what symptoms during pregnancy require immediate medical attention, and what emergency care options are available during and after delivery? For cancer, what screening should I be doing based on my age and risk? And what symptoms should never be ignored? For general health, what routine checkups are most important for me? So you might fall in 2 categories. General health is for everybody and one of the others. So for general health, the second question is, what warning signs mean I should seek urgent care immediately? So finally, blindness, amputation, maternal deaths, cancer. These are not just medical conditions. They are indicators of how well a system protects its people. Because in the end, healthcare inequality doesn't just determine who gets treatment. It determines who gets a chance to live and who doesn't. And this is what I want you to understand. Your perspective is growing, your knowledge is growing, and you're having a better day because you are aware and informed. Thank you for being here. Like, comment, share, and subscribe. And as always, we'll talk in the next one. It's a wonderful day. Get out and enjoy the view. Thank you.